I want to tell you a little bit about the retainers that Innovative Orthodontic Centers provides for their patients, because that could be kind of a confusing area. A lot of people don't really understand what retainers are for, and retainers basically retain the teeth in the position that they're in the day we complete your treatment. So retention is a very, very important part of treatment. Once you're done with the active treatment, which is either the braces or the Invisalign, then you go into a retention phase, which approximately lasts a year. Retainers are to be worn about a year full time. So that means you just take them out to eat, brush, and put them back in. If you follow that protocol, that's going to ensure that your teeth stay in that position, and that's sort of the guarantee that they will. The less you wear the retainer, the more risk you take in your teeth shifting during that first year. And what that allows the teeth to do is it allows the bone to heal very nicely around the roots of the teeth in their new position. So that's basically the premise behind retainers. There are different kinds of retainers that we make. Our younger patients who go through interceptive treatment are going to complete that phase of treatment in typically about a year, and they're normally going to be about 9 or 10 years old, and so we normally make Holly retainers. Holly retainers come in and out. They have a wire bar across the front, and they basically sandwich the teeth in between the wire bar in front and the plastic on the inside, and that's how they keep the teeth in their place. Now remember, an early treatment patient who's of that age is still going to have baby teeth and adult teeth. So you're going to come in for appointments, and we're going to alter that retainer for you so that as the baby teeth fall out, it can easily accommodate adult teeth coming in. And we want to try and keep that retainer worn until all the adult teeth are in, so it can be between a year to 2 years. The first year, we would like for you to wear that retainer full time, but then the second year, you can wear it at home and at night. That's for the early treatment patients who are typically around 10 years old. All other patients who got braces or Invisalign of the adult teeth are going to need to wear retainers for a full year, full time as much as possible, taking the retainer out only to eat and then putting it back in after you brush. My favorite kind of retainer is made by Invisalign. It's called Vivera. It's completely clear and visible. Nobody sees it, so nobody knows that you're wearing it, which also makes you want to wear it more because nobody even knows that you have them in. It does not interfere with your speech, so you can speak confidently and comfortably without worrying that you sound different or funny to your friends or family. What I love about the retainer too is that it completely encases your teeth so that there's no chance of them shifting whatsoever. And also you get 4 sets of those trays, the retainers, so that the 4 sets of retainers you will have to wear during that first year to year and a half of your retention phase of treatment. Again, it's the most amazing type of retainer to me because it doesn't allow the teeth to move. You get 4 sets and nobody can see them. They're very, very comfortable. The other kind of retainer is called a Holly retainer, and that's pretty much the typical retainer that everybody gets after braces treatment. And again, you're going to be wearing that one full time for a year, and then nights only after that for the second year. So that's the information about retainers.